Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
This is a neonatal unit at Mulago National Women and Neonatal Hospital. Here are part of the close to 50 prematures and their parents.
Nali nzimbye n'emikono, then ngenda mu hospital. When I took her, basanga pressure yange eri waggulu. Then they told me that baby wange bagenda mu jam okusobola okusavinga baby even.
A premature birth is a birth that takes place more than 3 weeks before the baby's estimated due date. And the causes are known.
These mothers have infections and sometimes they are not identified. Before they know it, they are causing them to be born prematurely. Then we have also mothers who are delivering babies who are preterm because they have some uterine abnormalities. Some of them have fibroids, they don't even know they have fibroids. And others also have chronic diseases like diabetes, hypertension, other heart diseases, kidney diseases, and they don't know. So sometimes they make these babies to come out early because the mother is not in general good health. And then also we have a growing number of mothers who abuse alcohol and other substances of abuse, and this actually also largely contribute to preterm deliveries. Then we also have an increasing number of teenage pregnancies.
Chokutamba says premature babies, especially those born very early, often have complicated medical problems. Typically, complications of prematurity vary. But the earlier your baby is born, the higher the risk of complications. However, she says there are higher chances of survival if a preterm baby is born in hospital.
Because we are able to identify complications like breathing problems, like problems of feeding, problems of the brain not functioning well, and problems of infection disease babies, and we treat them when they actually come and deliver within our hospitals where we are able to actually manage these babies.
In this ward, parents are encouraged to do the kangaroo care, which the nurse says greatly improves the growth of the preterm.
Abasawo bakugamba nti kangaroo yegenda okuyamba okutaasa obulamu bw'omwana wo sikiraba nnyo buzibu kubanga omwana wange mwagala njagala abeere ng'ali bulungi ate akule ng'ali bulungi.
It helps them to have good brain development, it helps them to build their immunity, to bond with their mothers, and when actually these babies are put under kangaroo, the breastfeeding chances are very high because the baby will always be looking for the breast, and the baby will breastfeed better and grow better and will have a better outcome.
Chokutamba also shares some tips on how to avoid or prevent preterm births.
So we encourage all mothers to first of all, be in general good health, to avoid the chronic diseases like diabetes and hypertension, but also encourage mothers to also be able to screen for some of these infections. And many times women may have low abdominal pains and we ignore them. So it's good to always do a routine checkup and we're able to identify. Then we also encourage all our young girls not to conceive and have babies when still young, because the chances of them having babies prematurely is really high. And also to reduce on the use of drugs of abuse like alcohol, if you excessive alcohol intake.
Uganda ranks the 28th worldwide in preterm births with an estimated 13 babies per 1,000 live births. Approximately 226,000 babies are born too soon every year, and of these, 12,500 children under 5 die due to preterm complications. Walter Mwesije, NTV.
National Medical Stores, NMS, passionate about your life, with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities